We're now going to move into a set of presentations which will set up a panel discussion where we're really keen to get your questions as well. So I'm going to introduce David Pearson, who's the chair of the Nottingham and Nottinghamshire Integrated Care System and also the chair of Tech Quality. David.
Thank you very much, Paul. So I think from the discussion, the wonderful presentations this morning, I think there are three distinctive features of our time that are critical to the development of care treatment in the context of technology. First of all, the biggest demographic explosion of longevity in our history in advanced economies. Secondly, resources. Health and care, according to the Institute of Fiscal Studies, needs to grow at about 4% per annum just to stand still. And I think that doesn't take account of the fact that service commissioners, providers, caregivers, organisers are having to adjust and respond to new needs that just did not exist a few years ago. These two facts are driving the desire to bring together service responses across sectors. A need to have interoperability, if you like, between health, social care, housing and wider communities. A fundamental plank of this is to have the ability to combine information which better understands needs and risk, and to be able to provide that multifaceted support which enables people to remain as much in control of their lives and as independent as possible. We need to test the boundaries to help not only manage people's circumstances, but to personalise their care and support and help people to stay connected. Population health and well-being and population health management, which Paul has already explained this morning, are critical features of that. But the third of the three distinctive features of our time is, of course, technology. And in that respect, I think there are a few certainties. Technology continues to play a part, and an increasing part in our lives, including contributing to people helping to manage their coordinated care, their person-centred care, and overall response to need. And the role of technology will, of course, increase, not as a standalone, but in the context of a range of digital tools and services. So I think the scope of what we have traditionally described as technology-enabled care is due to expand. Modern tech is best when it includes the effective use of data, blends into consumer technologies, and Jeremy has just given the most fantastic example of that in development, and has the service wraparound. And therefore, interoperability between different systems, both human and technical, is absolutely crucial. And there will be major changes that will affect these progressions, including, of course, the move from analogue to digital. And we've seen across the world, and places like Sweden, the impact of this, where they've moved directly to more mobile technologies. So the question for us is, how do we all, as users of the services, providers, commissioners, the overall populations we serve, take advantage of these opportunities whilst making sure that this rapidly changing environment is navigated safely and effectively? It's a wonderful opportunity, but equally, if we don't manage it with care, then we run the risk of undermining the progress that we want to make. And not only navigate it safely, but how do we make sure that our staff, our workforce, are equipped, motivated and inspired to deliver the kind of solutions we would want for our families, for our services, and for the people in our communities? And my answer to this, of course, is that quality as it is at the heart of this, not as an optional extra when we have the time, but as an essential part of that journey. And it plays to the heart of leadership. As a former long-standing Director of Adult Social Care, I was once asked what the priorities were. And I said, well, we've got to make sure we know where we're going. We've got to have a strategic direction. We've got to manage the performance, and we've got to make sure that we are managing within budget. Oh, and by the way, we've got to make sure that the quality of what we're doing is important. And over the journey of the 15 years that I was a director, I realised if we hadn't got quality, then all of the other things, our ambition would be thwarted. And more importantly, the people would not get the service they deserve. So things such as data, workforce, culture are critical to this. And this is why the industry, through TSA, developed the standards, which we now have been in operation for a few years. And we have certified, through an accredited UCAS scheme, approximately 150 organisations through that quality assurance framework. The slightly disturbing fact from my point of view is there are still 200 members of TSA who aren't part of that quality assured process. And I would be interested in engaging in a wider discussion later and personally with anybody who wants to about that and about how we can make sure that we are an industry which actually has the confidence of the public, of the commissioners and of ourselves in terms of what we are doing as we embark on this technological revolution. And we know that this encourages teams and services to act differently. It's one of the things that is rooted in the practical steps to excellence. And we know from experience that it has enhanced teams who are much more effective in running the service. It's an effective team and service development tool. And importantly, will reduce the risk to those who depend on technology, improve the customer service and the reputation of the services and businesses that are in this sector. So there's nothing more important, it seems to me, than making sure that our services and our offer as we move forward is safe, effective, person-centred, efficient, timely and equitable. Absolutely crucial principles. And by adopting a clear quality assurance strategy, we can have the confidence about the service, showcase it, and celebrate its success. Thank you very much.